Hello, this is Michelle Walker. Today we're going to be doing NG tube skills. We're going to be not only placing an NG tube, but we're going to be doing lavage, gavage, and talking about suctioning. So since we're going to be doing a procedure, we're going to go over the 12 steps. You're first going to verify your patient and your order. You're going to perform good hand hygiene before and after patient care or handling any equipment. You're going to verify your facility policy on the procedure that you're about to perform. You're going to refer to your manufacturer recommendations on any equipment that may be used. You're going to knock on your patient door and identify your patient with two identifiers. You're going to provide privacy and make sure you introduce yourself and explain the procedure that you're going to do. Get an overall assessment of your patient, and then you want to raise the bed for good body mechanics and dons any PPE that may be necessary for the procedure. Upon completion of the procedure, you want to lower the bed and then raise the guardrails if indicated on the patient care plan. You want to make sure that the patient's call light and personal belongings are within reach, and report any abnormal findings to the charge nurse. And today, per our order for Mr. Gastritis, you are going to, we're going to be administering a feeding, Glucerna feeding. So for the 6 patient rights of medication, you want to make sure you have the right medication, the right documentation, the right patient, the right route, the right dose, and the right time. All right, so we're first going to be talking about inserting the NG tube. You first want to, make sure that you're assessing the patient. You want to do a focused abdominal assessment. You also want to ask them about any previous history of nasal surgeries, deviated septum. You want to take, upon assessment, you want to look up their nares for, any blockage. Of course, if they did have surgery on one nostril or the other, you don't want to go up that nostril. Use the other one. And then, of course, Mr. Gastritis, we checked for his allergies. He does not have any allergies to medications, so nothing contraindicating there. For the focused abdominal assessment, you want to lay them down in supine position. So we're going to go ahead and do that. And just make sure he's comfortable here. So you first want to bend down and look at the abdominal contour. And make sure there's no distension. Note your findings there. You want to look above the patient for any asymmetry. And then you want to auscultate and then palpate. So we're going to grab my stethoscope here. And starting in the right lower quadrant, you're going to listen to each of the 4 quadrants moving upward and down. (5 to 35). Vowel sounds is normal. Note your findings, and then you want to palpate, making note of any tenderness, any masses. And then you also want to ask your patient before you start the procedure of any, what their bowel hygiene is like, what their last bowel movement was, the consistency, the color, what's normal for them, so that you know what's in the normal parameter for them. And now for the procedure, you want to make sure that they're in Fowler's, or high Fowler's is preferred if tolerated. I'm going to put Mr. Gastritis back up here. Okay. Make sure that he's comfortable and just go over the steps with him. Make sure he knows what you're doing at all times. And so I already looked up the nares, and we're going to go with this left nostril here. And you want to first measure, and you want to take the tip of the tube and measure from the tip of the nose to the tip of the ear, then down from the tip of the ear down to the sternum, the xiphoid process here. And you want to take your pen or tape and mark right there, because that's where you're going to end your tube feeding. And it also lets the oncoming nurse or doctor know where the placement is supposed to be. Okay, so we're going to get our tape ready and Don's any PPE. And the tape is, got the tape. Used all my other tape in the practice. Okay. Okay. So you would just have your tape ready here. And you're having some jelly here because you're going to need some lubrication for feeding the tube down. So make sure you put that at the tip. And you're going to tilt your patient's head back to begin with, and just make sure that they're breathing normally, breathing in, and you're just gonna wedge it back there until you get to the oropharynx, and then you want to bring the head forward, and you would have assistance at this point in a cup of water with a straw, and your assistant would be encouraging the patient to take sips of water to feed the tube all the way down until you reach that xiphoid process. So, and then that's where your tape should be. All right, so once you hit that, you're going to take your piece of tape and you're going to anchor it temporarily while you confirm your placement of your tube. And you just want to refer again to your facility policy. Most places are going to have you do an x-ray to confirm placement. Others may have you check the pH of aspirated fluid from the stomach. And, but again, just follow your facility policy. Once you found placement, confirm that, then you're going to take your anchoring tape and some benzoin tincture, put it on the skin and the tube to make sure that the tape will stick. Okay, take your tape. And you're going to split it halfway down. Anchor onto the nose. Then you're going to take the splitted ends and you're going to wrap it around the tube, weaving one way. And then you're going to take the other half, weave it around the next way, the other way. Okay. Then you're going to take another piece of tape and you're going to anchor it to the shoulder just so that there's, as the patient moves around, they're not going to be moving their placement. Okay, so he's all set there. And you just want to make sure the patient is comfortable, document how the patient tolerated the procedure. You want to document where you did the drawing of the tube and any abnormal findings. And so next we're going to talk about suctioning. So this patient, since they're getting the nasal gastric tube for no bowel movements for the past 8 days, we're going to be hooking up the NG tube to the facility's suctioning, whether it be on the wall or a machine. And we're going to be putting it on low intermittent suction. So you would go ahead and screw that on and make sure the patient again is in the proper position. Before you do any suctioning, lavage, or gavage, you always want to make sure you have confirmed placement of the tube before doing any of those procedures. All right, and then next we're going to be doing lavage on this patient. And I just want to note, and you want to always confirm the surgeon's preference is whether they want this airway open or if they want it plugged. Some of them have a preference of keeping it open for air. So just make sure you confirm with your surgeon on that. So for lavage, again, you want to make sure you do an abdominal assessment prior, and then place them up into the high Fowler's position. And you're going to be taking your syringe, tube, and container. And per this order, we're going to be doing normal saline, 0.9%, and we're going to be lavaging until the contents are clear. Okay, so you want to push fluid in and then aspirate out and continue doing that until clear. So you would draw up your fluid. Unanchor right here. And then you want to push in your fluid. And then aspirate out. And done. And then continue doing that. You would draw up more fluid and push in. Continue doing that until it's clear. Okay? All right. Next, we're going to be doing, or lastly, we're going to be administering Glucerna. So we're going to be doing gavage. For this, again, you want to confirm placement. Before starting that, you want to look at your the feeding that you're administering. So we're administering Glucerna, 1.5 cal, 100 mLs, and we're going to be flushing with 50 mLs of water. And always flush before the feeding and after the feeding, clearing any feeding in the tube. And you want to make sure that with feedings, you never lay them down because it puts them at risk for aspiration. So make sure they're in a Fowler's or high Fowler's, and you're going to be checking the residual first before any feeding. Per this order, you're going to be checking the residual here. If it's less than 150, you're going to return the contents to the stomach and proceed with the feeding. If it's over 150, you're going to hold the feeding and the contents. Do not go back to the stomach. And you're going to notify the doctor and see what they want to do from there. So you're going to, so after you check the residual, you're going to push the fluid, so 50 mLs, you're going to flush with, and then you're going to hook up their feeding. You want to check the expiration and the integrity of the Glucerna before administering it, and then flush again after the feeding. And then you want to clamp your tube once you're done with the feeding and the flushing, just so that the feeding doesn't come back up. And you want to make sure your patient tolerated it well and that they're comfortable before leaving. And let's see here. Make sure their call light is within reach, their personal belongings are within reach. Report any abnormal findings to the charge nurse, and also make sure you document those as well. And we're going to be flushing it every 4 hours per the order, checking for residual. Okay, and I believe that is it. Thank you so much.